The last thing I want to talk about in this lecture is coding, and you may already be familiar with this based on your work as EMTs or scribes or whatever it is that you're doing. You may have some experience with coding, but really, coding is the foundation for fee for service reimbursement. So, in order to get paid, really reimbursement is based on the patient's diagnosis in case of the hospital or procedures performed on the patient in terms of physicians or clinicians. So it's all based on designated codes. So the International Classification of Diseases, we call the ICD, is currently in the 10th revision, and it is a publication of the World Health Organization with the purpose of creating a common language all over the world in diagnosis and for reimbursement. So the codes are periodically revised. As I said, 10 is the most recent version of that. And in practice, these ICD codes are used for the reimbursement purposes. So they'll give a number to a specific disorder, and then that's how the reimbursement is triggered. So it's important to understand the specific codes that are being used within the facilities that you work. So the ICD codes are used for diseases. CPT codes, current procedural terminology codes, were developed in the American Medical Association. And the purpose of these CPT codes is to create also a uniform language for reimbursement to describe medical, surgical, and diagnostic procedures. So the CPT terminology and codes are also revised to reflect what's happening in current clinical treatment. So, there can be different codes and a number of different codes for different procedures. So when you go to your physician, there's going to be a code for having that physician's visit, but also the level of intensity of that visit and what specifically may have been done during that visit. So it's important to have some familiarities with the codes that are being used. Most medical facilities have these pre-printed forms that outline all the codes that are typically used in their practice, so makes it a little bit easier, just kind of check off what was done. But that's how the insurance companies, they have the set fees that may be reimbursed based on whatever it is that was done or whatever the diagnosis is. So that's how they know. It just triggers that code triggers the reimbursement system to provide that reimbursement. That's it for paying. There's some other tasks for you to do on the Plato course site. So do some exploring about paying for healthcare.